Today we are going to learn how to reduce a fracture dislocation of the elbow. Elbow dislocations are the second most common major dislocation, second to the shoulder joint. It is the most commonly dislocated joint in children, and posterolateral dislocation is the most common type in 80% of the patients. Now, elbow dislocations can be classified as either simple, in which there is no fracture, or complex elbow dislocations, in which there is associated fractures. A 48-year-old female had a fall from standing height with trauma to her left elbow. She presented to the ER with a lot of swelling, pain, deformity, and inability to move the elbow. This is a still photograph of the patient in which the left elbow is fixed in a fixed flexion deformity. There is a lot of swelling and deformity around the elbow joint, with lot of tenderness around the radial head area and lateral and medial joint line. The range of motion is very painful and restricted. As we can see posteriorly, there is a prominence of the olecranon with an empty space just beneath it. As I can put my fingers, there's a lot of empty space beneath it. AP and lateral views of the same patient were done. Here is the lateral view of the patient showing a posterior displacement of the radius and ulna, indicating posterior dislocation, and in the AP view we can see the radius and ulna have moved laterally, so that will be a lateral displacement in the AP view. Also, we can appreciate, if carefully examined, there's a radial head fracture here. It's Mason's type 2. So because of the associated radial fracture, this injury that the lady has sustained will be a complex elbow dislocation in which there is a fracture of the radial head, and it's a posterolateral type of elbow dislocation. Now I shall demonstrate the reduction technique for this complex elbow fracture dislocation. Here we require two people to do the reduction. The patient is seated and an assistant stabilizes the affected arm, while as the surgeon flexes the elbow, supinates the wrist slightly and applies a distal and a downward traction at the wrist. Once this traction and counter traction is being given, the other hand of the surgeon is placed just distal to the elbow on the volar aspect of the forearm, applying a slow and a gentle inline traction until a clunk is appreciated. Once the elbow dislocation is reduced, the deformity disappears, the patient becomes immediately pain-free, and a range of motion can be possible. Here I'm slowly flexing the elbow, which was earlier not possible in the same patient. The patient is in a lot of pain because the patient, in addition to the elbow dislocation, also has a radial head fracture. Here the elbow dislocation is reduced, and after the reduction has been achieved, it is maintained in an above elbow plaster of Paris back slab, which is intended to be kept for a period of 2 to 3 weeks, and the patient is also placed in a arm pouch so that the limb can be elevated. These are the post-reduction check X-ray of the same patient. Here we can see concentric reduction of the elbow joint. One can also appreciate the Mason's type 2 radial head fracture. Thanks for watching.